Good day. I'm Sinead Patrimonio of BSN1E. Today, I am going to demonstrate the bed making for an occupied bed. So firstly, before anything else, we have to do hand hygiene and prepare all the materials. So these are all the materials we're going to need for our bed making. We're going to arrange this according to use. So the first thing that we're going to use is the bottom sheet. The bottom sheet should be at the uppermost, and the next is the rubber sheet to prevent the bed from being drained or soaked with water or secretions. And next is the draw sheet that would help us lift the patient as one and prevent injuries. So in lifting patient with the use of draw sheet, you will need the help of another nurse. So in the principle of moving and transferring patient, we'll know that we have to get as much as help as we can so that we don't get hurt our back and provide maximum safety to our patient. And the last thing is the top sheet. The manner in folding is different from top sheet and the bottom sheet. And the last is the pillowcase. Okay, so which is the last part in bed making. That's when you're going to change it. And now, I am going to teach you how to fold and prepare first our bottom, top sheet, draw sheet, and rubber sheet so that it will guide you how to properly place it as you perform the bed making. So it can be a bottom or top sheet, but now we're going to prepare a bottom sheet. We're going to change it according to use. The soft side should be seen as you fold it. And then the other side with my assistant is going to fold it here and on the other side. As you can see, it is the reverse or the other side of the bottom sheet. And then fold again. And then the other side also. Okay, and then fold it again. And then fold. So this is now our bottom sheet. So for the rubber sheet, it is the same as bottom sheet since the side is the waterproof should be touching the patient and the draw sheet. Okay, and then fold again. On the other side also, and then fold. Okay, so this is now our rubber sheet. Next thing is the draw sheet. Okay, and then fold. On the other side, and then fold it again, and then fold it again on the other side, and then fold. So this is now our draw sheet. Okay, so now with the bottom sheet, rubber sheet, and draw sheet, they are now prepared and folded in the same manner. But with the top sheet, it is different because the soft side should be the one touching the patient. Here in the top sheet is reverse. Okay, fold. Fold it in the other side. And then fold it again. And then fold it again on the other side with the same manner. Okay, prepare and then fold. Again, fold it again, and fold. So this is now our bottom sheet. And the last thing is the pillowcase. So let's begin. After we prepare the materials and linens needed, so make sure to place it in a clean dry surface. After that, make sure to wear gloves so you have systematically loosened it one side before the other side. Up next, you're going to get the pillowcase. So in the manner of getting it, you have to reverse this way. So make sure to hold soaked linens away from your body so it's not getting contact with your uniform. Okay. When you take it for disposal, make sure you start from the uppermost and roll it to the center and hold it away from your body. Roll. And hold it away from your body. We are now going to start. We should start now putting on the bottom sheet. So put it in the center. And then tack it here to anchor it. The soft side should be the one touching the patient to avoid bed sore and skin irritation. So this is the time we're going to anchor the bottom sheet on this top portion of the bed. We call this miter. Make sure you tuck the upper portion and secure it and that get lie low. To have this triangle support it here, and tuck it here, for the bottom sheet, you have to tuck it all the way. So this is the miter. Tuck it. And then same principle. Make sure you tuck the upper portion and secure it and that get lilo. To have this triangle support it here, and then tuck it here, and tuck it again. So we call this miter. Same principle, tuck it all the way. So that's the time to do all the finishing to ensure that it is free from wrinkles, because you know wrinkles, it could create friction, and friction may cause skin irritation and bed sores. So we shall now start with the rubber sheet. For the rubber sheet, place it in the center. And then tuck it here. So and on the other side, pull it here. Alright. So that's the rubber sheet. Next is the draw sheet. Put it in the center. Tuck it in here. And then vice versa. Okay, so this is the draw sheet. Now, we are going to put in the top sheet. The soft side is out, and in our bottom sheet, we miter it in a top portion, but for top sheet, we're going to miter it in the bottom portion. And we have to miter the top sheet. Same principle, grab to form a triangle. Unlike in the bottom sheet, you don't tuck in it and do it on the other side also. And then on the other side. And then, same principle, grab to form a triangle. I will put the pillowcase and fan fold it. So, let's start inserting the pillow with this manner. So, there's an opening should not be facing the door. I have to place the pillowcase in this manner. I have to put this in this manner. So if I do this, this is a closed bed that is ready to receive new patient, closed and unoccupied bed. But if I do this, but if I do this, this is an open occupied bed. I'm going to show you how to prepare a surgical bed, most especially when you receive patients from the operating room or from the emergency room. Just the same principle, but the only difference is how you place the top sheet. So, I'm going to teach you how to do it. Same principle. Place the top sheet and fold it. So, tuck it here. Again, tuck it here. And then same principle, do the my dear. Now this time, you have to tuck it here and fold it in this manner. This is the surgical bed. When you receive the patient here, the side rails up and the client will not turn to maintain this final position. That's how you prepare the surgical bed. This afternoon, I'm going to perform a bed making with a patient. So firstly, you have to do hand proper hygiene, and I'm going to introduce myself to my patient. So I'm Nurse Sinead and I'll be changing your bed linen. So the reason why is that we could prevent skin irritation and provide comfort and a clean environment for you so that you can rest well and rest comfortable, sir. So is it okay with you? Okay, so side rails down and kindly grip my hand, sir. Okay, and we can move it and flex it against my resistance. On the other side again. Alright. So client's ability to participate. Side rails up. So first, I shall move your pillow. And can you flex it here? And here, at the count of 3. Okay, 1, 2, 3. Side rails up. So we will now loosen the top sheet. Place the bottom sheet. Tuck in this manner so that you will have a hard time pulling it. This side is the used and side by side of the new one. So don't forget to do the mighty. And then tuck it in again. And then the next thing is the rubber sheet. Tuck it inside the rubber sheet as the rubber sheet tuck in the new bottom sheet. Okay, tuck in. And next is the draw sheet. So in this manner, you are ready now to turn the patient. At the count of 3, 1, 2, 3, making sure the privacy of the patient. So this is the time I will roll it from the upper portion to the lower portion. Alright, and place it in a hamper. After that, let's fold it one by one. Starting from our bottom sheet, pull it and tuck in. Don't forget to do the mite there. Okay, so pull it. Do the mite there and tuck in. Next is the rubber sheet. Next is the draw sheet. Pull it and tuck in. Sir, kindly turn. Okay, side rails up. I'm going to change the top sheet and the pillowcase. So I'm going to change the top sheet of my patient. So tuck in first. So do the miter. So in this manner, you will ask the patient to hold the top sheet as you pull down the old top sheet. Please hold it, sir, for your privacy. Before we're done, we're going to create a 2 plates and I'm going to pull. Side rails up. Okay. And the last part is our pillowcase. Just tell me if you're uncomfortable, sir. Okay. And then fold it before, and this one you can start inserting your hand on this manner. And with the open side should not be facing the door of the room. Okay? So that's all for today, and thank you so much, sir, for your participation, and don't forget to wash your hands after.